Deputy Minister for Health, Dr. Joe Patla, Her Excellency the Ambassador of the United States of America in South Africa, Ambassador Lana Marx, the USAID Southern Africa Mission Director, John Kroek, and all other representatives of the USAID and
all right.
From the national...
Let's go back to Barra.
And other provincial government departments represented here. The CEO of Chris Hani Baragwanath, Dr. Alicia, and Prof. Rudo Lufuno Mativa, Head of Intensive Care Unit, other members of staff in Baragwanath, members of the community, members of the media, all the clinicians, the heads of department, and different professional categories, members of the media, friends, good morning to you all. Let me start where Ambassador started. First, I want to thank you for raising the issue of the tragic death of Mr. Floyd in the United States of America. His death is a dark mark in the history of mankind, particularly those of us who know the fight against racism and discrimination, and the sacrifices that many of our leaders, including President Nelson Mandela, Reverend Martin Luther King, and many others who fought for equality, who made us know that the only right thing to do is to stand up for our rights. It has been the saddest and most traumatic death that has taken place in the full glare of the public, wherein no explanation will ever suffice for the sheer brute force that the abuse of authority that it demonstrated and the anguish it caused, not only to the family, but particularly to the black community in the United States and black people all over the world who believe that this is nothing but naked racism. And in the process, it raises the sores of the many years of the brutalization of the black people over the years through slavery, through all sorts of other forms of discrimination and oppression. But I think you have made a good point that we get these instances, as our President Cyril Ramaphosa, quite aptly commented, that whenever there's abuse of power in any country, including our own, that we need to stand up and object to such and make sure that we move society towards a situation where those become a history that we can talk about but not experience. And therefore, you would notice at this stage that people all over the world have stood up and said, Black Lives Matter, and enough of this kind of naked racism. And I'm glad to say that there are many American people who have stood on that side of the principle of freedom, of equality, of the respect for human rights. And I believe, therefore, that the pain of the loss, unfortunate loss of Mr. Floyd, really should act as a bond that unites humanity to never ever allow such abuse to ever happen. But thank you for raising it, because coming from yourselves, it's also one of those difficult questions that we must understand that whilst we have got an ideal of a future where there's equality, there's human rights, but that every day we're going to live with the imperfections of human beings. And therefore, working together, we need to really make a firm undertaking that we shall forever fight against such abuse, and that the flame of freedom, of democracy, of coexistence, human coexistence, and tolerance shall be the way that will define our future. So I want to thank you for raising it, and I do want to say that for all of us who have been traumatized by this, we can only find solace in the spirit of solidarity of all our people who will say, it cannot happen, not in our name. Thank you very much. Having said so, I also want to then pay tribute as well to yourself as a new ambassador. I've never had an opportunity to welcome you in a public event, but I need to do that because I've been highly impressed with the energy, the enthusiasm, and the vigor with which you have tackled your program. We've had several meetings wherein I've remarked about the fact that with you as a partner, representing the partnership between the two countries, there's a long distance for us to cover. And therefore, I've been very, very impressed. In this case, we have come to witness or to receive this great gesture of friendship, support, and solidarity, which is a donation of the ventilators from the United States government through USAID, wherein we've received the 50 via-air ventilators LTV 2000S, which is at a market value of 486,000 rands per ventilator. The first 50 have been received. We're expecting 950 to come. You have made this your own undertaking, and I'm rather pleased that you have made it your own direct, deliverable. And so every now and again, I know you always give me updates as to how things are happening. This is a response to a conversation between President Trump and President Cyril Ramaphosa, where President Cyril Ramaphosa raised the issue to President Trump that there are various very important necessities that we need to deal with COVID-19 that have gone into short supply globally, and then did impress upon the President of the United States to always see where they can assist the African continent when such necessities are in short supply. So I was quite pleased to go and report back to President Ramaphosa that their conversation where this undertaking was made has actually borne fruit, and I'm sure we all recall that President Ramaphosa ultimately made a public acknowledgement of that donation. And therefore, we are here to express our gratitude to the government of the United States for the contribution. We are also here to acknowledge the partnership that we have always had in various areas together with the United States government. This day would have happened 2 or 3 weeks earlier. However, because of clashing programs, we had to shift it up to this day. I want to thank MEC Dr. Masuku, because he has had to run around trying to fit when is it likely to happen, and ultimately it has ultimately happened the way it has. And so when the batch of ventilators were to be received, we actually asked Professor Mkhize, who's a member of the Ministerial Advisory Committee and one of the intensive specialists in the Ministerial Advisory Committee, to have a look and give us an advice. I was pleasantly surprised. Not only did she praise the make of the equipment, but she quickly decided that all of it shall be allocated to Baragwanath, Chris Ali Baragwanath. And by the time I went to consult the MEC, I realized that she had sympathies from the MEC as well. Now, this decision was taken to bring the ventilators into this hospital at the time, Premier, when the modelers had envisaged that the first peak that's going to get out of control on COVID-19 was going to be Gauteng, and then followed by KwaZulu-Natal, and thereafter, possibly later, Western Cape. Of course, I think we all are aware now that the models didn't quite get it right at the time, because now we've got to focus on the Western Cape as where the epicenter of the COVID-19 is. Therefore, the next batch that will be coming, let me make a public declaration, and the first take will go to the Western Cape. And we have already decided to take a portion of this first batch and sending it to the Western Cape. And so they are handy, as Professor Mkhize was explaining to us, in that it is able to offer both a kind of positive pressure, which is really less invasive, as well as a more intrusive kind of mode, which she will be explaining much more for us to understand. And by the way, I heard she was saying that you were saying that you were also trained by her, and you mentioned quite a number of them. I'm sure Baragwanath and Gauteng is very proud of having this baby born in this hospital, worked here, trained here, works here now. You've done well. Thank you very much, and thank you, Premier, for those very kind words, because I must say I get absolute cooperation from Dr. Masuku, and of course I have a wonderful team of MECs, and a whole lot of them very energetic and always on the spot, moving ahead to see what else they can do to serve our people. So he belongs to that crop which I'm very, very proud of. I don't always say this, I'm not sure I've ever said it, but I'm really very, very pleased and honored to serve with them. All of them much younger. I suppose somebody asked me whether I sleep, is because I've got too many young people who keep me awake. He's one of those. But you are trained by Dr. Mkhize. Now, Professor Mkhize didn't train me, he trained you. But he trained with me. So if I may just make that clear, together with Dr. Patla, we actually shared the same class. That was many years ago. That's obviously long before you were born. So I want to therefore say, indeed, this hospital is in fact a historic monument. It's really one of the epicenters of clinical excellence in the country, both in terms of training and in terms of the clinical care. So I've got full confidence in what this hospital does and what it can do. But similarly, I really do want to pay tribute to the health workers in our country. They've done a remarkable work. And the fact that you can see the way that we're managing the COVID-19, it's really up to the dedication of the health workers in this country. And therefore, when we are today coming to make this contribution, we are saying we will do more to make it easy for them to execute their commitment of caring for our nation. And whatever that is needed, there are many other items that we are in short supply of. We were discussing the issue of personal protective equipment. We have made an undertaking that no health worker should be allowed to go into the front line and care for people who are possibly COVID-19 positive without being properly trained and properly equipped and protected. It's our undertaking that I'd like all the managers at hospitals, regional, district, and provincial and national level to always honor that all our staff needs to be protected. It's like taking your soldiers to a battle. You always make sure that they are protected, but they're well trained and they're well armed. And this we will want to undertake as we move on. And so, thank you for this contribution to arming our forces as they go to battle. It's a very, very important contribution. We are, as I was talking about some of the areas, are working hard to eliminate the backlog in testing, because as you look, we have done over 850,871 tests. That's a huge number, but nevertheless we do accept that it's still not enough. And from that point of view, we are actually continuing to source additional diagnostic kits so as to make sure that there is no hospital, there is no doctor, there is no nurse, there is no patient who feels that they are not able to get adequate care simply because they couldn't get the results from the COVID test. And therefore, we did indicate yesterday that we focused a lot on the Western Cape, and from where I see the backlog that they reported has actually been dropped. The latest of the figures that I monitor puts them at about 10,000. I know Gauteng is much higher, and KwaZulu-Natal, but I think you'll understand that we are now dealing with 2/3 of the caseload in the country, in the Western Cape. And of course, we look at the weight, the weight of the burden. It's not a provincial matter. There's only one campaign on COVID-19. That's led by President Cyril Ramaphosa. There's only one program. The plan that we're executing is the same every part of the country. And therefore, there's only one way of dealing with it. Everything is now the resources that are available for South Africa. So whether it's a public or private laboratory, it matters not. What matters is that that's where testing gets done. We've integrated everything in that way, and we're working very well at that level. When it comes to the shortage of beds, we have actually been pleased to see how, from Gauteng, we have moved all the way to create additional field beds. And I do know that with the current focus, we are now going to have to increase those beds. You've probably heard quite well President Ramaphosa talking yesterday. He said, very nice, thank you. So many beds that have been provided, but I wanted to provide more. And I'm in complete agreement with that sentiment. We had already informed them that these numbers that we are seeing mean that they need to start commissioning new beds so that by the end of the month, those beds are already ready to come to stream. It's the same message I would like to send to you. More beds, because as well, from what we can see, we are still facing the storm ahead. And I think South Africans need to be aware that we have actually eased the restrictions and the lockdown. But that doesn't mean that COVID-19 has eased. It's actually worsened. And therefore, the impact thereof is going to be worse as we move on. And South Africans need to understand it's no longer going to be about how much we can treat people in the hospital. It's about how much we can prevent more people getting infected so that they don't land in the hospital. If you come to the hospital, we're quite certain that our staff will do our best. And so the numbers that we're seeing have gone quite high. And at the moment, we're talking about numbers. The last record was 43,434, which is quite high. And as we've said, 66% of those are one province. Now, we need to learn something about that. Firstly, that the breakup did happen during the lockdown in the Western Cape, and therefore the cluster outbreaks that happened there are the ones that really went out to spread it into all sorts of different districts. And now that you are easing down the lockdown, the restrictions, we must expect that the numbers are going to start rising in more provinces than Western Cape, more than what we are seeing now. And therefore, this issue of behavioral change becomes the crux of the prevention. It is not going to be what the doctors and nurses and government can do. It is what each and every one of us as individuals are going to do. The WHO came out yesterday and was making a strong emphasis about the use of the fabric masks. And the point being that nobody must walk out and venture into the streets without wearing a mask, both to protect you from anyone who might be having the infection, although it's more effective as it protects others if you have the infection. And that is what has been proven scientifically. It becomes therefore very important for us to say to our people, let's not lose focus by fighting regulations. Let's really focus on what is it we can do to change behavior. The regulations were meant to just assist, to help people to get to the understanding that there are many things that we need to now forego because we're trying to protect each other. It was not because there was a sense of trying to control the lives of people. It is basically try and create an environment wherein people understand that whilst you've got a right to enjoy yourselves, there may well be certain things which, whilst you're enjoying yourselves, could be endangering the lives of other people. And we were very, very appreciative of the decision that were taken by the religious leaders. And I can tell you now, if we think that these numbers are high, what we would have been able to get had all the churches, all the mosques, all the which one did I miss? Synagogue, that's the word I'm looking for, sorry. Thank you. And all the places of worship, and all the large weddings, and all the large funerals, if all of those things continued, we would be somewhere far away from where we are today. And therefore, we do want to continue to thank those religious leaders for going ahead and providing leadership to say, we shall hold all of this, all the prayers at home. And I like the statement they made. Turn your home into a church, turn your home into a mosque, turn your home into a synagogue. Your home must become a place of prayer. Even though government has said, well, we could open up at that level, it's really to say that there is no intention to restrict the freedom of anyone, but it's to be able to make a point that as you try to go back to a normal social life, there has to be a change. The change in behavior is what's going to save the country. And therefore, we don't want anyone to turn around and say, well, all these rules have been declared to be unconstitutional and irrational. Well, I think there's a technical issue there. When we've got time, we can sit and debate a number of those issues. And I think that where there are challenges, we need to learn from those and correct what needs to be corrected. But what we can't lose is that there's all the rational reasons for ensuring that people understand that there has to be a certain limitation on some of their day-to-day rights and activities, not so much because it's rights being taken away, but more because you need to protect each other. And that's really what we're trying to focus on. If there was a way of making people change behavior, needing no rules whatsoever, we would have opted for that one. Because then we would know that people are sufficiently empowered to be able to change conduct in such a way that there is no rule that is necessary. And of course, we must thank South Africans for the extent to which they were able to take up the message. If I stand here and look at how many of you are wearing masks, if I look back, if we were to talk about you wearing masks at the beginning of March, none of you would have thought we were serious about it. But to look at the amount of change that has happened, it's still not enough. We still need people to understand. So when we raise the issue of restricting gatherings and funerals, it's not so much because we think that the problem only arising from the body, a COVID-positive patient who might have died and is being buried. It is more the conduct of us as we support each other, comfort each other, and working, staying very closely, coughing and sneezing with all the body, fluids from our mouths and from our eyes, that poses the risk. And that's what we're trying to explain to everyone, to say, it's not because one wants to restrict how you bury your beloved. In fact, if you were to go to the Eastern Cape, the major source of common point contact that has been identified has been the funerals. Now, we did explain a number of things in relation to the funerals, and if you know people of South Africa and people in Africa in general, you really cannot say to anyone you can't go and bury anybody. It's the most sacrosanct kind of act of bidding farewell to your loved ones and to your relatives. So there's no government really who would want to go and interfere with such a sacrosanct ceremony. However, we need to send a warning to say we have already got records of people from what we see, KwaZulu in East London, where the first mixing happened, where the scent of the first cluster of infectious cases were recorded from. These are concrete things. When we talk about churches, in the Free State, we're actually go and throw in a lot of resources to restrict movement of people and test a lot of people. And we did that because we had learned from the experience of Daegu in Korea, where in one church setting, patient number 31 generated so much of infection that a term was coined of a super spreader. And looking at how that church service had gone, it looked like something went wrong during the service, during this buffet, during the social settings that they had. That at a certain point, 60% of people who were positive were all traced to that particular occasion. It's not more about whether we want to restrict the freedom of worship. So I think we need to always understand this, because our biggest challenge is going to be how do we get our people to internalize the message of a change in behavior. A change in behavior that does not need to be based on the fear for the soldiers, for the army, for the law, for being imprisoned. A change of behavior that is going to be driven by the compassion that says that in case I might be having the infection and I'm not aware, I shouldn't infect the next person. A compassion that basically says it is common courtesy for all of us to talk about each other's behavior and say you should be wearing your mask so that in case anything happens, there's some degree of protection. Keep the distance, sanitize your hands, wash your hands. This is the kind of culture we need to now develop. If we are able to send such a message to the public, then certainly I think we would have been able to make an impact. And that, for me, is where the focus should be. Unfortunately, from the point of the principle of prevention to implementing and working together in the various other departments and the consultations and everyone having to raise their issues, then we have to end up arguing about alcohol, about tobacco. All those issues, for us, from the health point of view, There is nothing to recommend alcohol and tobacco for. Full stop. Everything else comes because South Africans, as society in general, always wants to raise issues about this right to enjoy this, right to trade on this, and so on. And that's how the issues become, complicated. But if we were able to understand in the first instance, it was never about all of those issues. It was all about let's try and protect each other. So right now, we've done everything that we could. In particular, I've indicated the numbers of people that we're about to screen. About 15 million people. The screening is very important. But more than the fact that we could find out whether they are positive or negative, or whether they need to be tested or not, the engagement on the symptoms is an educational process itself that we believe it will be able to be replicated as people begin on their daily setting to talk about the symptoms of this thing. Now, 15 million people are talking about the symptoms. At least we've spoken to those, we know. The issue is you could have been screened, you can get infection soon thereafter, but now you'll be more alert because someone has spoken to you about it. So we believe, therefore, that those issues are quite important. It is of concern to us that the numbers of people who are losing their lives is increasing. And in fact, we were actually looking at the numbers that 70% of the deaths are actually coming from the Western Cape. When those numbers in the Western Cape stop increasing, it will not be because there will be less people getting infected and dying in the Western Cape. It will be because the other provinces are beginning to catch up, and therefore the leveling of the percentages. The numbers will increase unless we focus on the behavioral change. That is the aspect that we have to deal with. Interesting issues have been raised in terms of what is seen to be helpful, in particular the question of the use of oxygen. Tigerberg, they've reported how a number of the patients that went onto oxygen early were actually saved from the infection. And Professor Matiba was telling us that their management here is superb. And I want to say we do need to pay tribute to you, Prof, for all the work that you and your team have done, but particularly the training of the many other intensive care specialists that our country has. We want to thank you for that, because at this point, we will need a lot more of those. We need to train more of those, and therefore, we need to actually make sure that even in small districts, there's adequate expertise to be able to cover at that level. So there's a fear or a concern about a possible shortage of oxygen in the future. We are working on that matter. We are going to be engaging the manufacturing companies so that we can see how we can ensure that the first cut in terms of additional oxygen that gets produced in the country and made available will actually be available to deal with all our patients. So all of those issues are for us very important issues, and we must also say, with our own health workers, we do wish to convey condolences to those of those members of staff who have lost, the members of the families that have lost members who are members of staff. At this point, in the last count, 2,084 of health workers have actually been infected and found to be COVID positive. That, as of, I think, the 1st of June, and of course 800 of those have recovered. And we have lost, at this point, 18 of those members of those health workers. As I said earlier, to us that's tragic. We will always do everything to make sure that we save the lives, not only of all our people, but also prioritize the health workers as well. So therefore, at this point, we do want to send a message that we are here to celebrate a partnership, because what has become clear is that the fight on COVID-19 is not going to be just a fight which is only about health professionals. It's the intersectoral response that is associated, it's the partners that we have, both from different governments and the multilateral institutions, WHO, which is actually our lead body that gives us all the guidance in terms of the protocols that we have to utilize. We want to indicate our confidence in the WHO and its leadership, particularly the Director General, Dr. Tedros Ghebreyesus, for the continuous support that they give to us. And in South Africa, for every province, we have got specialist expert teams that have got representatives from experts from WHO. So we want to express our gratitude to that. But in addition, in the country, it's an interdepartmental fight. The issues that have been raised about shortages of water, sanitation issues, the issues of housing, human settlements, there is a whole program now of de-densification that's coming. The issues of the economic challenges that we have to face, we have to work together on all of those. These issues are very, very important. Right now we're going through a whole challenge about education, whether the children should be going to school. And we're making a point that the children, we are saying we need to start opening up the schools. We're not saying that we want children to go there and get infected. We are saying this pandemic is going to be with us for a long time. We can't abandon schooling. We can't abandon, economic activities. We've got to slowly adjust with a new normal, a new reality of how you go to school with a mask as a kid. How do you go to school and be screened before you walk into the class? All of those issues, we're actually going to find lots of teething problems. But rather than fighting and criticizing each other, let's look at how we can help each other, how we can make it work better. Because at the end of the day, we are seeing that there are children who it might be possible to do e-learning from a distance, at home, but the bulk of the children in our country don't have adequate connectivity to even be able to think of, being part of e-learning. And even those where there might be connectivity, the levels of poverty are such that you'll not be having everybody having PCs available for those, for the tablets available for those children. So this is a problem of us having to try and work together. And I think as well, what we have seen is the various structures in society, civil society, business, everyone coming and getting involved. We were quoting an example of how working together in the Free State, we were able to actually hold the figures stable for a long time after a huge explosion. Mainly because it was government and the church and the community and everybody worked together. Which means that when we focus on identifying and testing, isolating and quarantining, that is still the mainstay of our strategy that works. As I was in the Western Cape in the wilderness area, I went into the Ceres Valley where all these orange juices and all the other come from. This town of Wittenberg, a small town, was able to show us that again this intersectoral, sectoral response is the way to go. So I'm saying we've got the formula already of how we can actually fight this infection. So we need to focus on where we can contribute and build this thing together. This very strong fight against COVID-19. Now with partners, such as what the United States of America has done in contributing. And of course, I do have to pay tribute for the support on the PEPFAR and other programs, which we believe are very, very important contributions. So on behalf of the ministry, myself and the Deputy Minister, the National Department of Health, and the Provincial Departments of Health and the Health Fraternity, we want to say thank you for this contribution, and we want to say thank you very much, Premier, for your leadership. I've had you speak out there now, and I said, sounds like you're really gunning for an honorary degree in medicine. The way your understanding of the issues is a very, very important issue, because at this point now, we want to hear the mayor, we want to hear the councillor, we want to hear the premier, the member of parliament, talking about COVID-19 as though they were the professional trained in it. The information has to be so general that everybody must use it on a day-to-day basis, that an NGO person, a church leader, must be able to give the correct message of what we need to do to fight this infection. If we can get to that point, we'll be very close to winning the battle. So this is the start. Case management is an important issue, but social behavioral change is the key. Thank you very much. Sorry, can I just say, please take your seats. I've got this mask. So I want to just say to Premier and Dr. Masugu, we have received a donation of these masks. And so we'd like you to share them with the staff, because we'd like everyone to use these masks. But in the workplace, then we reserve all of these specialized masks. But as we travel along, then we need to make sure that our members of staff, our government officials, our civil society, and our communities, they use other masks. So these masks will be useful because it can be kept for a whole year. Just wash it and change it and so on. So I'd like to hand over this donation to yourself. I'll give it to yourself and Premier, so that you will see how we can do it. It's 10,000 masks here.